I appreciate the chance to talk and to share what I do. By trade, I was trained in physical therapy, and back in about 2014, I was introduced to the Postural Restoration Institute. Some of you may be familiar with them. But I started looking at kind of what they were saying about asymmetries in the body and how that affects the movement and your diaphragm. And so some of the stuff that they said truly resonated with me, but there were some times where I was doing some of the things that they said, or I was on in one of their classes and they say, oh, you felt this? Yep. Oh, great. You shifted. And I'm like, not quite. So I started looking at more, what is it about breathing and what is it about our body position that influences breathing? And I was training at the time for marathon running, trying to get faster to qualify for Boston. And I wasn't really changing any of my training, running on a treadmill, doing a long run, doing some strengthening. But I started shifting how I breathe. I started playing with different ways of breathing, different ways of holding myself. And I realized that I could be in the middle of a fast treadmill run, it's like a tempo run, and my nervous system, I could get it to calm down. And I felt like I was the coyote and the roadrunner. You know, the roadrunner and his legs are moving, but the body's not. It's truly how I felt, except my arms and my legs were moving. But I had this calm all over me. And I realized that as I was increasing my physical challenges and my sympathetic nervous system was kicking in, I was able to mitigate it and bring it back down just by changing the way I position my body and the way I breathe. And the side benefit to that is all of a sudden, all those runner tightness, aches, pain, boom, all went away. Because I was calming myself down, getting my body position back into neutral, and it just freed up my arms and legs. I stopped stretching. I stopped scraping. I stopped rolling. I stopped doing all those traditional things that I used to teach people. And I learned in physical therapy school that, you need to do to control stuff. And so at that point, it was a little shocking. And then the next marathon I ran, I dropped 7 minutes. So if you're a marathon runner, that's will make you very happy at the end of the race. And then the next one after that, I dropped another 7 minutes with no other changes in my routine. Flew through the Boston qualifying times. And I was like, okay, I'm on to something here. I'm still studying the PRI principles, but there's something more to it related to our sympathetic nervous system and being able to get ourselves into parasympathetic mode. And how can I teach what I felt and experienced? How do I start teaching that to other people and cause an internal change in the way they feel and sense their body? So I started applying it, and I'm going to go through kind of what I've pieced together and everything. But I just want to tell you this story because it helps make sense to where I'm at now. So I started experimenting on traditional physical therapy patients. And at first, you're kind of bumbling, trying to figure out what is it I need to teach them and get them to understand. And eventually I started seeing people in chronic pain that were getting out of pain. Saw people with nerve injuries where their nerve symptoms, like laceration of the nerves, healed much faster than a typical time healing frame. Saw people who had acute rotator cuff tears who couldn't lift their arm up, and in 2 days they could get it up overhead, even though an MRI said they had several tears. Things like bone-on-bone osteoarthritis, getting injections for several years, daily anti-inflammatories, scheduled for a knee replacement because there was no other help. Again, worked through this with a few visits. They canceled their surgery, haven't had another shot, another medication, and that lady, she's in the medical field, and that was in 2016. So it holds. And so it's a matter of then, okay, how do I do this? How do I teach it? How can I communicate it? Started studying more about the sympathetic nervous system and still discovering things today. And I started my own practice. I got hired to travel around the world to keep a guy out of a couple surgeries. That's why I have penguin pictures and from Antarctica. Came back and started my own practice and started working with clients one-on-one. So I'm like many of you guys who are cash-based, I'm the same thing, because I want to be able to spend an hour and a half to an hour with a person to get them to sense and feel and shift. Because one of my main goals is I need to be able to communicate to that person to get them to sense and feel something differently to shift them. So what started out as just helping people in pain has now branched into helping people with stress, focus, psychological and emotional abuse, trauma, sleep issues. It's branched into these things because I've taught this to masterminds throughout the country, and I start getting feedback from people about, you've helped me with this, you've helped me with that, you've helped me with that. And so now I work alongside with psychologists, psychotherapists, and psychiatrists to help their clients shift out of this fight or flight mode by taking away the physical status that's also putting them into fight or flight mode that they don't even realize it's happening. Simple things that we were taught as a little kid and even in PT school that I found that put people in fight or flight mode. And I say this with caution because I know my audience here, and I used to teach this stuff all the time. And so I really would love to go back and apologize to a lot of the people that I put in fight or flight mode unknowingly for the first 5 years of my career. So I'm just saying that with a caveat. And it's taken a lot of experimenting, a lot of tears were shed as I was trying to figure out what I fell into, and how do I teach this better with people. So when COVID hit, I had a practice before that in Scottsdale, and I've had people come in from the Valley, from all over the country to go through this experience. And now I've shifted it to online, and I can teach this online because I can see what people are going through and shift them and have them go into different positions, and it truly helps them. Plus I record it and say, here, go practice. So that next time we meet, we can progress. So I want to go through some of the basic principles of what I teach people, and then kind of share with you maybe some stories and how I analyze a person that's coming towards me, or if I'm speaking to a group, helping people. And I've done this with corporations as well, where I do a group and teach this overall so they can calm their, the employees are calming down and improve their focus. So I'm gonna, before I even start talking, I want you to guys just to get a feel for your body, if you don't mind, sit in your perfect posture. So sit in what you think is perfect posture and just get a feel for what is working. Do you feel your neck working? Do you feel your back muscles working? Shoulders, abs? Where do you feel your body weight? Is it on one butt cheek, both butt cheeks? Do you feel it on your thighs? I just want you to get a feeling of where do you feel your body weight? What do you feel holding you up? And just also get a mental picture of where is your rib cage? Can you tell if it's high? Can you tell if it's low? Can you tell if it's normal? Whatever that might mean. Just get a sense of that right now. Now, I want you to just take a second. Now sit back in your chair if you're no longer sitting back in your chair. Allow your low back to relax and let your belly spill out. Okay, and I want you to see if you can feel a shift in what muscles are working and what's not working, and if you feel the tension level in your body change. We are often taught to turn sitting into a position of exercise. If you think about sitting as innately a position of rest and relaxation for the human species, we've turned it into an exercise where we don't use sitting as a form of relaxation. So that means energy that could be devoted towards mental, emotional tasks is now being diverted to our body and holding ourselves in a position of tension. So I want to guide through that. Now that you guys have an idea, I'm going to stand up and move. So if you think about your rib cage.
Everybody, please make sure you're muted too. Just double check. Thanks.
So if you think about your rib cage, the word cage, cylinder, it denotes something that's protecting something. We want a rib cage in pretty much a cylinder type form. So it can protect our organs, our spinal cord, anything else that's on the inside of our trunk. Now, when we're taught from very little, chest out, shoulders back, suck up your gut, when we're taught that, we take a rib cage and we now shift it so the front of our ribs lift up and we start to hinge off of our low back. Okay. You guys might have been able to feel that when you sat up tall, if you sat up in the perfect posture with your shoulders back, chest out, sucking up your gut, you may have felt how the front of your ribs lift up. Your low back goes down. Now you become a hinge off your low back. And you may be able to tell if you have a lower rib flare and it drops off. Now, in order for you not to tip backwards, your pelvis tips forward to accommodate that. And we know that when our pelvis is tipped anteriorly forward, it often decreases the space available for our hip joints. And our body weight shifts forward to the front of our feet, which changes the orientation of our body weight, which is going to put more pressure at the front of our knees, front of our feet. So, and the reason I bring this up, because I often see people who are early heel rises, or people who are used to being on the ball of their feet. Their calves are really defined, their back muscles are really defined, but they don't have any butt or thighs. And it's a position of fight or flight mode. If you think about anytime you had to flee or fight something or freeze, that's a position of fight or flight mode. Now, I also work with little kids with ADHD, and a lot of them, they're on their toes all the time because they don't know how to calm down. And when we get them back on their heels, boom, they calm down just like that. It's a radical transformation. So if we think about the rib cage position, the chest is out, shoulders are back, we're kind of doing that perfect thing where we're trying to lift up our rib cage. Now our shoulders are pulled back. That's going to decrease the space available for our shoulder joints, which also affects our neck, TMJ, you can get headache issues. But the important thing is our sympathetic nervous system lies in our back along our spine. So if we're using our back muscles to compress on that sympathetic nervous system, that tightens our muscles throughout our body without us consciously thinking about our muscles contracting in that way. We just put ourselves in a position to create confidence, strength, power, you name it. And then we get stuck there all the time, and our muscles respond to that sympathetic stimulation and they contract all over. So this is why if you can change the rib cage position and how a person breathes, you can change their hamstring length just like that. You can change their flexibility just like that, because we're changing the nervous system. So that's one aspect of it. Then if we think about, okay, we have our body in a certain position, we're taught to be in that certain position for whatever activities we're doing, sports, performing arts, speaking, weightlifting, you name it, we're taught that. It's great. Obviously, we have the system to help us at certain points in our life. The problem is if we stay in that position all the time, we're zapping our resources, we're zapping our energy, we're zapping our ability to perform in other aspects of life. Now, if we think about all the stressors in our life, work, finances, driving, now we have pandemic, we have, relationships and kids, we have all these things that add to our stress level. And what I often see is that let's say if we start down here in parasympathetic relaxation, we get a few stressors, we may feel something, we may not. But if we don't recognize it and take the time to release that tension internally, we are now at a new level. And then you get a few more stressors and you just keep bunching up and you keep going higher and higher. And you may not realize it. You may see it as, oh, I'm buzzed or a little bit of tension or I feel tight. But if you don't realize and know how to get down back here, you habituate even more. I often see this with people with chronic pain, stress, anxiety, that their levels just keep going up. And they wake up one day and they've crossed a threshold, and now all of a sudden they have pressure, anxiety attacks, chronic pain. Because as their stress levels increase, the muscles are tightening on a body that's out of a neutral position. And then they wake up and they have pain and they can't get out of it. And so sometimes they can do external modalities, which work great to help them bring them down. And sometimes it brings them down enough that they don't have issues for a long period of time. But what we can do is change them. Kind of like I was talking about on the treadmill, I calmed myself internally, but I was still able to perform at a high level. I could feel a shift in my body. I could change the way my muscles worked to calm myself down, to alleviate stress and pressure in my chest. We can teach people how to do that so their body frees up. And what happens then is I've seen this with clients who've gone through trauma and abuse. A lot of their past is held in different muscles in their body and in different locations. I often see it held in the armpits, in the breastbone. Those are two very, very common areas that is very scary when I have them start to learn how to lift their arm up and expose their armpit and learn how to release. And you can do that with people and they start to have releases and they start to shift out of their trauma state into a freedom state. And then they can process whatever skills that they're working on with their therapist or their psychologist. So why does all this matter? So if we know our body position affects our sympathetic nervous system, and we have all these stressors that are always going to be around, we'll also look at how breathing can help us come out of sympathetic mode to parasympathetic.
Mhm.
There's a lot of breathing methods out there, tons and tons and tons. If any of you guys are familiar with Wim Hof, he has this hyperventilative breathing to help people get through cold situations or boost things about them to get through extreme situations. So he basically ramps people up beyond their sympathetic threshold so they fall down. So what I try to do is take them where they're at and bring them back down where they can control it and feel it. So if we think about your breathing, and I'm just going to go through basics, you have your diaphragm inside your trunk, and you have a dome that compresses down on diaphragmatic walls. Okay, it's lopsided, so I'm just going to go with symmetrical because it's easier. Now, if our dome drops down when we inhale and it contracts on those walls, it creates negative space for air to flow in. When that process happens, ideally it stimulates your vagus nerve to calm you down. And then you exhale, air goes out, your diaphragm goes back up. So obviously we want to try to stimulate the vagus nerve and we want this process to kick in as best as possible. Now, in order for the diaphragm to work really well, the diaphragm walls need to be strong and supported so the dome has something stable to contract against. If they're not strong and supported, then the dome doesn't have anything to contract against. So if you think about what could possibly support the diaphragmatic wall, that would be your side abdominal muscles and your rib cage being down. You can test this on yourself, and I do this and I'll test myself occasionally. If I lift up my chest, my ribs are flared out. Now when I breathe in, I have to lift up my rib cage to get air in because I'm not supporting my diaphragm through my side abdominal muscles. If I drop my ribs down, my side abs are kicking in, my belly's out. Now when I breathe in, I didn't have to lift anything up. I didn't have to use my neck, my back, my shoulder muscles, my intercostal muscles to lift up. Now I've shifted what I use to breathe, and I truly am using the diaphragm, and I'm not reaching for air. A lot of people who have stress and anxiety, they get to a point where they say, I can't breathe anymore. I hear this so often. It feels like I can't breathe. And what's happening is they're so used to initiating their breath through lifting up the lower ribs. They lift up and they go, and they initiate it from right here. So they've lost the contraction of their side abs that supports their diaphragm. So they're lifting up their ribs to create space for air to get in. Now, the problem is you can only lift your ribs up for so long, and the muscles get, more and more toned. They get to a point where they can't lift up anymore. They feel like they're suffocating. And so what I'll do with them is teach them how to drop their rib cage down, their sternum in, get their rib cage to deflate, feel the side abs drop down. And then when they breathe in, initially it's going to feel hard, but they start to learn how to free it up. And all of a sudden, they can now breathe differently. They can get air in that they couldn't get in before. Their whole stress levels come down. Now, so there's steps to what I do. The first, when I'm teaching people this, we want their breathing, their body to just calm down so they can feel relaxation. From there, depending on their specific circumstance, whatever's going on in their life, let's say, for instance, they have shoulder pain. What I'll look at, and I look at everyone individually, look at how they're moving, when they do simple things like bend over, when they reach, what's happening, because you can see stress in their body and how that's contributing to them continuing in a fight or flight mode. So we know then what to break down. So I'll go through a little bit. I just real quick, anyone have any questions before I continue? I know I've said quite a bit so far.
Oh, I do.
Yeah, sure. Jennifer?
Have you noticed a difference in posture and those changes in men versus women?
So yes and no. So it depends on the type of man or woman. That sounds really bad. But there are certain things with women. So women who are largely endowed, or they are used to with a curvature, lumbar curvature, and then a large buttocks, they are in such chronic pain because they're so overworked on their low back, and then they have a flat thoracic spine. They're in constant fight or flight mode and they have no idea. I am working with a psychologist right now who's like that. And first she thought I was absolutely crazy that I would ever consider her in fight or flight mode. And now as I've pieced it apart, she's actually dumbfounded that the fact that she's in fight or flight mode just based on her body position, and she can tell a difference. So I see for women that have that huge lordotic curve, severe chronic pain. And I hate to say this, women who've had breast augmentation, severe issues, severe issues. Now I'll also see with men, anyone, and sometimes there's women, but I don't see it as common, men who have learned to suck up their gut, lift up their rib cage from all the weightlifting and hold their arms out. They'll often get a lot of joint pain, and especially in their lower extremities, hips and knees, that when they learn how to drop their rib cage down and learn actually to bend at the fulcrum of their xiphoid process, pains go away just like that because their pelvis frees up, the tension out of their body goes, and they can get back to doing their things, avoid the joint replacement. Yeah. So there are some commonalities in people. You'll also see people who have a shift to one side. So when someone tells me they have some kind of right-sided or left-sided thing going, I also look side to side and say, okay, where are you guarding yourself and relying on a protective state on one side versus the other? And then it's a matter of, we have to get you to sense the opposite side so you can release the side that's problematic. So that's also helpful. So any other questions? Okay. So I just want to go through kind of a little bit of the process of what I look for in people to tell me that they're in a fight or flight mode, because I think this might be helpful for you guys when as you're starting to look at different things. And these are some of the common, I'm just going to go through some of the more common ways. So when I look at someone, just in general, this is what I do through Zoom. I'll have them stand and they're going to move their arms up and down. And I'm not necessarily looking for arm motion. What I'm doing is looking at what is going on to their rib cage and their back as they're moving their arms up and down. A lot of people who are in fight or flight mode, they'll go like this, or they'll lift up to the side, and that's all they know how to do. They don't know how to access their arm muscles outside of using their back to lift up their rib cage. I'll look at how they are moving their legs. So are they able to bend their knee up without kicking up their back? Because people who are in fight or flight mode are like this. So I'm not necessarily looking again at their movement, but what is their natural tendency on how they move on simple daily activities? Because things like that, it adds up over the course of the day. If they're reaching, I look to see, do they reach like this? A lot of people reach like that instead of being able to move their shoulder blade. That tells me how guarded they are inside themselves. That keeps them in a protective mode. And I'll talk to them. I say, it's basically like you've been shrink wrapped to your rib cage where things don't move. And it's fearful and it makes you vulnerable to allow those things to move. So if we go there and we're trying to get you to free up your body, your mind, and your emotions, I have to give you something to stabilize you, to allow you to move. Okay, so it's one of the things. As I look at someone, I'm going to look at how they squat. You know, are they able to squat and allow their butt to tuck under them when they squat to feel their legs? A lot of people squat with their huge lordosis in their back so that they never use their legs. And it's another protective response because they're ready to fight or flee or sprint. So all throughout the day, there are things that go on with people. And so if we start to bring awareness to them and what they're doing throughout their day, we can change their daily habits so that they are not using their body in a fight or flight mode status, but allowing it to do different work so that their muscles activate differently and it calms them down. So as we go through it, the first thing I do, and I'll go through a little bit of the breathing with you guys tonight, just to give you kind of a flavor of it. First things first is we got to get the rib cage down. And that I work on them through exhalation, because that gets an overall general relaxation. They start to feel their body differently. Then with time, we may look at how to inhale differently. Can you keep your rib cage down and then inhale differently? Depending on the person's needs, so if it's one-on-one, I'll then start to dive into, okay, what muscles do we need to teach you how to activate to provide stability so you stop using your back, stop activating your fight or flight nervous system so that you can calm down in your daily activities. If it's more for stress or anxiety, then we're going to go into different that allow the body to open up in a slow manner. Let's see, I'm gonna mute her. Okay. So if it's for stress and anxiety, we'll shift and start working on different positions that actually calm the body down. Now, of course, as you guys know, a person's interests or daily activities or daily habits are really important. So if it's someone who works at a desk, we're going to maximize using the desk, maximize them using their chair, their table, to get them to practice different positions that calm them down. Everyone sleeps at night, so always give some stuff for sleeping to help calm them down so that their body gets out of fight or flight mode at least before they get to bed. And then they can sleep in a more restful position, and often knocks them out for several hours, if not the whole night. So as we go through this, everyone's needs are, you try to meet their needs and where they're going. So what I want to do now is I want to teach you kind of just some of the basics of the breathing and kind of the seated position that I start people in to see if you can feel a shift in your body. So you kind of get in mind how you felt at the beginning when I told you to sit up, or sit in your perfect posture. I want to see if you can feel a shift from what you were feeling before. So in your chair, sit all the way back. We want your low back all the way to the back of the chair. Let your tailbone curl underneath you, and for some of you, it may feel like you're slouching. Let your upper back just rest into the chair back. We want your knees, we want your heels on the ground, feet flat on the ground, and your knees at the level of your hips or higher than your hips, because they'll make it easier for your tailbone to curl underneath you. Okay. Now in this position, we're going to have you put one hand on your chest, one hand on your belly. Okay. I also teach people to do this with a straw. I'll cut the straws in half just to make it easier on the cheek muscles, but I have them do it with a straw because if you blow out into a straw, you're blowing out into a cylinder. It makes it easier for your ribs to actually form into a cylinder. The type of breathing that we're doing, I want you to imagine that there is an open hose throughout your whole airway. We don't want any pressure or kinks in that hose. So no pursed lip breathing, no huffing breathing. We want an actual cylinder coming out of your mouth so we can get that rib cage out of that hinged position back into a cylinder. As we go through this, just focus on your exhalation, get in as much air as you need to. Don't worry about how much you have to lift up your rib cage to get air in. Just be aware of where you're at right now. Okay, so we're gonna do one hand on the chest right over your breastbone, the other hand on your belly. Feet flat on the ground. I'm gonna demonstrate a second, 3 breaths, and then I'll coach you guys through it. So I'm gonna breathe in through my nose, pause a second, blow out through my mouth, pause and hold my breath for 3 seconds. I'm going to do that 3 times in front of you guys. I'll point so you know where I'm at, but I want you just to keep an eye on what is moving, what's not moving, because I'll give you an idea of where we are working to get you. Okay, so here I go. Okay, so I imagine you probably didn't see a lot of movement. You probably didn't see me lift up my head, my shoulders, or my neck, because I allowed my diaphragm to drop down. I focused my breath into my throat. It dispersed to my lungs. My lungs expanded generally all over. But then when I exhaled, my chest did drop down a little bit. My belly spilled out. But I didn't have to use my rib cage to lift myself up. I was able to calm myself down. My ribs dropped down, my belly spilled out, and there's this overall general relaxation that went through my body. And this is the relaxation I want you guys to feel a little bit tonight, because you use this to apply to people. This is what I do in the middle of a marathon to get myself out of pain. It's what I use in the middle of anything to calm myself down. In front of public speaking, I used to not be able to speak to more than one person at a time, but I use this, and now that my rib cage is down, I just feel a calm all over my body. So I want to help you guys go through this now. So if you can, one hand on your chest, one hand on your belly. We're going to start out easy, just getting you into a rhythm, and then I'm going to start talking to you and telling you more and more things to focus on. Okay? If you want to, you can close your eyes. I'm not going to be demonstrating anything, so just kind of work on feeling what I'm saying. So here we go. I'm going to do gentle breath in your nose. Feel the air go in your nose passively. Pause and blow out through your mouth. Hear the air going out of your mouth. Hear that whoosh. Then hold your breath. Hold your breath and breathe in. Gently breathe in your nose. Take note of what's happening to your body and blow out. Hear the air coming out of your mouth. Hear that whoosh come out of your mouth. Hold. Hold. Now breathe in. Gently breathe in your nose. Try not to be actively breathing in. Just let it go in. And blow out. Feel your chest melt down and in away from your hand. Feel your belly spill out. Hold. Now breathe in. Gentle breath in your nose to your throat. Feel the air go in passively. Pause and blow out. Feel your chest melt down and in. Feel your armpits relax as your belly spills out. Hold. Hold. Now breathe in. Gentle breath in your nose to your throat. Put your tongue to the roof of your mouth as you inhale. Pause. Now blow out. Make sure you have an O with your mouth. Blow out. Allow your chest to melt in away from your shirt and hand. Hold. Hold and breathe in. Gentle breath in your nose to your throat. Feel the air go in passively. Pause and blow out. Drop your collarbones away from your chin. Feel your armpits relax as space increases, your belly spills out. Hold. Now breathe in. Feel the air go in while your back stays relaxed. Pause and blow out. Feel your chest melt in away from your hand. Your ribs drop down from your armpits, your low back relaxes. Hold. And breathe in. Gentle breath in your nose to your throat. Feel the air go in without effort to your throat. And blow out. Chest melts down and in. Feel your low back relax, butt cheeks open up as you settle into the chair. Hold. Now breathe in. Gentle breath in your nose to your throat, keeping those ribs down as you inhale. Pause and blow out. Feel your chest melt down and in. Armpits relax as your shoulders drop down, belly spills out. Hold and breathe in. Feel your low back stay relaxed as you breathe in passively to your throat. Pause and blow out. Feel your sternum melt away from your hand. Feel your belly spill out as your midsection opens. Hold and breathe in. Keep that midsection open as you inhale in your nose to your throat. Pause and blow out. Feel your chest melt in. Belly spills out. Low back relaxes. Hold and take a break. So I'm curious if any of you guys could, if you want to comment, could you feel your chest dropping in? And if you want, you can nod your head. So first, were you able to feel your chest melt in, your breastbone? Some of you? Yay, nay? Good. So some of you, yeah, could feel your chest dropping in. That's huge. We want to have that ability for our sternum to actually move. Could you feel your belly spilling out as you blew out? That's a harder one. If you're used to sucking it in, could some of you guys feel your belly starting to spill out? Some of you could. Okay, good, good. Wonderful. So as we're going through this, one of the imageries I use with people is we're trying to get you away from the hourglass position where you're cutting yourself off at the middle at your belly button. We want to get you back into that cylinder so there's this open energy that goes through you. If we blow out and suck in, we're cutting ourselves off. As soon as you blow out and suck in, you can feel your rib cage elevate. It's going to tense you up. It's very vulnerable feeling to allow your belly to open up as you blow out. It takes a lot of practice because we're so geared to the other way. But as soon as our belly opens up as we blow out, you can start to feel aspects of your lower legs let go. You can feel your back let go. You can see how your body starts to shift. You start to get more mobility. You start to get freedom. Yes, Veronica.
So on the inhale, my belly expands out. It's already out. So on the exhale, I didn't feel like there was a lot of space to go further. It was more like I just had to relax into it more. Does that
make
sense?
So yes. So, and it's interesting. So when you inhale and you feel your belly come out, do you feel your low back activate as well?
Yeah, so I feel like the whole thing expands. The only thing I feel is like sort of at the xiphoid, like I have a belt. It's like my lungs can expand, my belly can expand, but there's this little kind of cinching still in the middle.
So that's a place where you have neuromuscular guarding. So there is part of you, and that's very, very, very common. No, I don't know your background and stuff, but I find that's extremely common right here. When anyone's had any type of trauma or severe stress, we guard right there. And so that's a big thing. And I go through a position where I actually have people have their thumb there and try to get that to relax, to become like a Pillsbury Doughboy, and that everything spills out underneath. So what I would suggest is not to push your belly out when you inhale, because when you inhale, we don't want just an expansion of the belly. We want an expansion of all of your lungs. So it shouldn't be just stick your belly out when you breathe in. I'm not saying that you're doing that, but a lot of people do that. But what we want is, and this is a reason I said, which I didn't tell you guys beforehand, breathe in your nose to your throat, because I want your air to go in horizontally to your throat. And if you focus on filling up your throat, or I tell people it's like you're creating a guttural feel, or you're trying to suck your throat backwards. When you do that and you focus on the air going here, you no longer lift up your ribs, you no longer cinch. And then the air disperses to all of your lungs. Instead of trying to just fill out the bottom of your lungs, you can start to get it into the top of your lungs, your upper back. And so it starts to open you up in new ways. And I'm gonna, real quick, one more thing. So one of the reasons why I talk to people about getting away from this back dominance and trying to flatten their back is because as long as these back muscles are kicked in, the lungs back there have a harder time expanding. So you're not fully inflating the back of your lungs. You're just keeping this flat, and then you have to go forward to get air in. So you're not truly using all of your lungs. So a lot of times I'll put people in positions where I'm curling, and I say, okay, and I don't do this with anyone that's new. It takes a while before I'll get them into a position where I curl them up, make them spill out right where you were talking about, Veronica, make them spill out, and then breathe from down here until they can feel expansion in their posterior lungs with their back open up. And when they do that, as soon as they do that, everything shifts, because now they don't have the pressure in their body. They feel like they can get air in, they feel light, they feel mobile, they feel like they can conquer the world. And so with you, I would definitely there's some work to be done right here to free you up so that you can feel when you exhale that your belly spills out and it stays there when you inhale, and it's not pushing out when you inhale, but that the air goes in. And it truly, when you hear it and you feel it for the first time, it truly sounds like your lungs are inflating. It feels and it sounds like they're inflating, and you don't have anything else contracting to get you there except your diaphragm, which you can't really feel too much, So any other questions?
Amy?
Yeah.
So when I'm not in stress, so I just got off work, so of course I'm kind of jacked up.
Yeah.
And so in this position, this time, the work, it's work. And so I can feel it like just like Veronica was saying, in the back of the scapula, between the scapula, actually, for me. And I found that it was almost like, oh, no, 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 no. And I had to take this upper chest breath when I when I knew better. I know how not to do that. But so my question is, in the moment of being able to shift that, even in the jacked up body that is today, because yesterday I could have done this one like for hours. I would have been fine, perfectly fine. And to assess it that quickly and then go boom, I would have a better day and not have as much neck pressure and pain if I could teach myself in the moment to catch it quick. So is that just by just doing it more often, or because I know how to do it and I can do it on a calm day?
Yeah. So whenever someone's learning something like this, kind of like a normal thing that you would think of, you want to start them in the most successful position as possible, in the least amount of stress position as possible. So I'll often start someone in a seated position or lying down. And lying on the back may not be good for them, so it may be on their side. So it depends on the person and what's going on with them. But I advise practice this when you're calm or relatively calm, when you don't feel the stresses of life. Now, sometimes we feel always the stresses of life, so you just find the most minimal of that. And you start to practice it, and then and I tell people this, only do it short periods of time. So I say, when you first wake up in the morning, because we've tossed and turned and done weird stuff to your body throughout the night. So you sit up and you do it in the morning. Then I say before lunch to help you digest. And then before dinner to help you digest, because as you open your belly, you're creating more space for your digestive organs. And then again, before you go to bed. And it's just about 5 minutes until you can feel your body start to shift. And you want to do it throughout the day, just for a few minutes throughout the day, so your nervous system starts to learn a new habit. I'll also do it if I'm sitting at a stoplight, just randomly throughout the day. I now implement it when I'm running. So I'll start the day with running, and I'm calming myself down, going through things, and I just get myself into this really chill mode. But for you, Kathleen, I would recommend through your workday, when you are going from patient to patient, stop if you have a chance from one patient to the next, do a couple minutes. So it starts to break up. So it's not this whole bolus of a day of stress that you can't shift out of by the end of the day. So if you can start to integrate it and then spend a few extra minutes before you eat, you can start to implement it in more stressful situations. And I'm serious. I used to not be able to speak to groups, and now I can speak to several hundred people. But I had to do this and practice it, so that way it's ingrained in me, so that I can feel this calming effect. My ribs are down, my belly's out, and I do this in front of people, but I'm calm. And I still can have high energy. And if I still want to ramp up and go really excited, I can stick my chest out and it's a bit there for me. but it's not there. It's not me there all the time and I can't go further. Because if you're in that ramped up mode all the time, you're expending energy just on existing, just on being there. And that's taken away from all the other creative and productive things you want to do. So if I can bring myself back down, then I have more energy to expend in whatever else is in my life, and I can remain calm.
So
And I have to,
yeah.
Go ahead.
I was just gonna say, so 3 or 4 cycles of it is enough to just click back down once you're used to doing it. Okay.
And it gets faster. The first time you practice, it may take you 5 or 10 minutes to feel your body shift. You will feel your body shift. And it's so powerful. And then as you get better, you can get it to shift in a minute or 2 minutes or 30 seconds or 10 seconds. You could just feel your body shift. You'll feel, it feels like a tingling sensation. Your body just starts to let go all over the place. And then you can start to learn to implement of how to use your arms and legs. So I can now reach, but I've kept myself calm. My ribs are down. And so now I'm at the point where I run, I'm moving my arms and legs, my ribs are down, my side ribs are flush. And if any of you guys were here, you would feel my ribs aren't moving. I'm talking, I'm calm, I can move, I can get my heart rate up, but it's not affecting me. I'm not going to go into fight or flight mode. And this is what we need to teach people, is so that they can do that as well, so that they don't get ramped up just based on their daily movements, their daily mental stresses, but how to basically have this internal tool to ward off additional stresses. So
Thank you. That's real helpful. And plus I've developed a standing station, and I don't know that that's actually better than if I'm always in a standing position all the time, but if I'm not sitting relaxed at all.
So with standing is good, obviously, get blood flow, get moving, you know, all that stuff. What I'll actually do with standing is I'll have a little platform under my desk and I'll put one foot up on it. And you hear that sometimes in physical therapy in general, but I actually use it. So I tuck my tailbone under me. So I spend some time where I'm like, okay, calm myself down. Don't let my back overwork to hold me upright. And a lot of times I teach people how to walk all over again, not using their back, but how to sense and feel their thighs. Because if they don't feel their thighs working, they use their back for stability, which is then going to ramp up their fight or flight nervous system. So it's a matter of teaching them how to truly feel their thighs, provide stability so their body can calm down. So I would suggest that for you, so you can play with that and you can then alternate feet and stuff like that.
Thank you.
You're welcome.
Quick question on running, since you're talking about running. So
Yeah.
when you're doing this during running,
Mm-hmm.
2 different questions. One, why do you exhale through the mouth and not through the nose?
Mm-hmm.
And do you do running with the same breathing, or do you do nasal breathing only while you're running?
So a couple things. So the reason I teach exhalation, and if I forget one of your questions, just remind me. The reason I teach exhalation through your mouth is because if I teach you to breathe out through your nose, which we want inhalation, exhalation, generally speaking, through our nose for all the benefits of our nose hairs. But by teaching you how to blow out through your mouth, it helps you activate your side abs. So I want to ingrain in you during these short practices how to feel your rib cage dropping down and your side abs activating. If you sit there and you go, you're more likely to activate your side abs to pull your rib cage back down into neutral. So then during the rest of the day, when, over time, you know what it feels like to hold your ribs down. You can breathe in and out of your nose and get the benefit of nasal breathing, and your rib cage is in position, so you're going to stay calm. And then just practice periodically blowing out through your mouth with the exercise positions I give you, so that way you can still, okay, I feel my side abs, feel my side abs. Now with running, I change my breathing a little bit, just because if I'm running fast or hard, I might not be able to get enough in my air. So sometimes I'll open my mouth a little bit, so I have air going in my nose and my mouth. But I do blow out through my mouth. Again, I get my side abs activated, holds my rib cage down. I feel so much more stable because I'm not tightening everything up in my body and my core that locks me up. I'm loosey-goosey and my ribs are down, so I can twist and turn. There's no stress to my back, my discs, or anything, because all it takes is my ribs are down, and I'm constantly practicing getting them down and holding them down while I let my back relax, my pelvis relax, so things can just move and glide. And this is how I use it to help people get out of pain. I've taught people how to use this in 50 milers and 100 miles to be able to run pain-free. Because as soon as you feel your body develop some type of pain, that means your position is off. We have to get you back to neutral. So I'll teach them these breathing. So like, let's say you're the front of the knee pain, right knee pain. And you're like, oh, okay, that just showed up. Or I fell, I did this in the middle of a 50 miler, fell, busted up my right knee, got up, again, did the breathing I just taught you, calmed myself down. Then I started walking and doing the breathing. Again, rib cage down, let my low back go, let my butt cheeks go, just really calm everything down. And then now it's time for me to get my hamstrings to activate. So it keeps my pelvis tucked under, so I stop getting front of the knee pain. And so then I implement the breathing so that my trunk is relaxed. So then when I hit with my right heel, my hamstrings kick in. It keeps my pelvis in neutral, the front of the knee pain goes away. Works for hip pain, whatever pain you want. And so and what's nice about running is it happens very quickly because you are breathing a lot. So you can shift your nervous system very quickly on what muscles you're using, and your pain goes away within a couple minutes. And so running is a very quick response, but you can do this with any activities or sports. But this is how you can get people out of who are bone on bone, joint replacement ready, on schedule. You can shift them out of it because you change how they sense and feel their muscles. Their body lets go. They regain space. They don't need the surgery because they don't have the pain and impingement anymore. I mean, chronic stuff you can do this with. Did I answer all your questions?
Yes, wonderful. Thank you. And then some.
Right away.
Do I have another question?
Sure.
How long on average does it take for someone to start to notice changes? Somebody that's like, say, chronic pain, like you're talking about.
I expect them to feel changes each visit.
Awesome.
Like each visit, because it's all about, can they feel something? There are sometimes people who have no awareness and sensation of what a muscle contraction feels like or a relaxation.
Mm-hmm.
But for the most part, people can feel that. They can, they may not feel it in the jet, immediately, and intensely, but they can start to feel a shift. If they can't feel something shift, that's also why you have them use their hands on them. They can feel like their rib cage drop away from their hand. They may not know what muscles are releasing or what's happening, but they can feel an overt change. So each time I work with someone, their whole program shifts and changes. It's what I give you is going to be some different from someone else. And even if I have some standard positions I put people in, I'm going to modify it for everything based on your background and what you can feel and not feel. But again, I do expect them to feel something different every time, going towards where they want to go. Yeah. Anything else?
Yes. Have you noticed people with keloided scar tissue? How do they react through this process?
So actually, I have someone right now. And so what I'll do with them, I actually have them use their hands near like the area where it's scarring and really building up. And I'll have them do the breathing, and they can actually feel a lot of release around the scar. And so I have them do it to themselves because a lot of times most people won't push that hard on themselves to generate pain. And so I can get them to, when I have them do a release or muscles, I tell them, so if here's my arm, as I have you move on your skin, I don't want you pressing down into that area. I want you to have your finger there, and the muscles in front of the finger where you're going, it's like I want them to splay and just separate from where your finger is. And when they do that, they can start to feel things release. So as my finger is going down, my pressure is down my arm, not into my arm. And when they do that, they start to feel, as they exhale, they have to be exhaling as they're moving. They can start to feel the muscles release. And especially around keloid scarring, things, you know, they have scarring, there's a lot of restriction in tissue, it can help with that as well. So I have a lady right now I'm working on with that. So yeah. Anything else? I have some questions.
Hi, Amy. This is Ian.
Hi, Ian.
Hi. Yeah, this is a great topic. It makes me feel very relaxed.
Good. Yay. That's one. Done.
We do a lot of breath work in my practices.
Right.
We do it, typically we'll start with someone in the ropes where they're offloaded, like in a prone or side lying or supine position. We do it for the neck and for the low back, really wait till they're, you know, some of those tense muscles start to let go, really work on that breath work and focus a little bit of the attention on the pelvic floor and relaxing that. And then we'll start like gently vibrating the ropes so they get a little bit of sensation as they're trying to continue to breathe through it. Then we'll start to gradually shake the ropes a little bit more, and then start having them move, you know, one leg, another leg, one arm, another arm, something with their head or their spine. So we'll start adding a movement. Have you seen anything like that, like what I'm describing? Because what you just took us through is very much like what we do. We just typically start them in a more offloaded position, you know, where they don't have any body weight to sustain.
Yeah, I actually haven't experienced the offloading through like you described. I can see how that could be very helpful, especially, you know, anytime there's body weight and muscles are contracted abnormally, they're gonna put someone in a fight or flight mode. Just pain alone does that. So I'm definitely curious about it because I think that's a neat way of doing it. And especially if you're vibrating the ropes as well. Sometimes vibration helps people let go of their guarded state in some areas. So we often relax when something's vibrating just because we're like, hey, let it go and, you know, see how my body receives it. So I can see how that could be very helpful. When you do it, do you start teaching them how to walk differently, squat differently, sit down differently, reach differently as well?
Yeah, there's always a functional carryover.
That's awesome.
So it depends on the person. And like you were saying, gender aside, it's a lot, it has to do with their body weight or how they've been holding themselves or what maybe emotionally they've been going through in life or in their history. So we try to get a lot of that out in the initial visits, and then we start providing kind of that functional carryover to squats. But even some of those things like squats and a lot of the standing exercises, we can even offload a lot of that too. So it's like kind of like an assist, if you can imagine like a squat, doing like an assisted squat where now the therapist has both hands available to like keep their neck from tightening up or their back, or maybe they need a little bit of help like with the alignment of their knee or whatever the case is. You know, we use the ropes a lot to kind of support the person through the squat or the lunge or whatever they're doing. Yeah,
that's great. And I imagine at some point in that you also work with them on internal control, so they don't rely on the ropes for long term and they can apply it. I imagine there's some type of shift in them as well, so they can sense things different. Is that kind of what you see in your clients?
Yeah, it depends on the person, but some require more assistance, of course, than others, and some we can really challenge a lot more than others, because not only does it work for really, you know, relaxing the person, but you can also go the other extreme and make the squats, for instance, like much harder than a normal squat. Yeah. Where you're shaking the ropes or they're unsteady, you know, their feet are like in ropes or in slings. So you can kind of take them across the whole spectrum depending on what you're attempting to do. I was just curious if you had ever seen that, because it's so, there's so much parallel to what you took us through versus what we do in the clinic.
That's cool. No, I'm definitely curious. I'd love to talk to you more about it at some point.
I
So,
think, Ian, you're going to need to do a Zoom on Red Cord. I see it coming.
Probably not me, but
Oh.
I talk more about the business side, but definitely one of my therapists would love to do that, I'm sure.
There we go. Okay, Amy.
anything else? I know I went a little bit fast and stuff, but I wanted to give you an overview and give you guys a chance to kind of feel a little bit differently. If there's any questions, if you guys want me to go through any patients, cases or anything like that, I can do that. But anything else that I can help you guys with? Yeah.
I have a question, but I don't know if anybody else is. Are there resources or videos or any of this that you have online for patients for them to go through that rhythmic breathing?
Yeah, so I actually, I have a YouTube channel from a couple months ago. I put some different breathings on. I also have a Facebook group where I lead this twice a week on Tuesdays and Thursdays at 6 o'clock Arizona time. I'll do it for about 10 to 15 minutes, and I'll kind of go through a focus of what we're going to do. Like, we're going to focus on your low back today, or we're going to focus on restrictions in your chest. And so I'll guide people through that. And that's free for anyone. I have the group as private. It's called PABR, PABR Method Wellness Group. I have it as private so it doesn't get spammed, but there's just a couple questions to answer, just so I don't get bots in there. But I do have that. My website also has some different interviews I've done where I've gone through this process or demonstrated this process. So that's always there for you as well. So yeah. Anything else?
This is not really a question, more of a thought, but the implications for pelvic floor physical therapy and COVID are just like, I'm having light bulbs all over the place.
Yeah. Yes, I've helped a lot of people with breathing issues with COVID, especially trying to get air in the posterior lungs. Since most people have really tight back muscles and try to flatten their back, they're not getting air in their posterior lungs. And then when they're supine, that creates more problems. And so I work on getting every aspect of their lungs expanded through different positions and getting them to feel that too. And it does help. It really does. So, yeah.
I have a question. You had us sit with our back against the chair and feet flat on the floor. Due to my stature, I cannot do those two things simultaneously. So when I sit in a chair, I usually am sitting Indian style, or I might have a footrest. Can you comment about your practices in that situation?
Yeah, so this is a big problem. So I encourage people, if they have a chair that goes up and down, make sure the chair goes all the way down so that they can sit down. But I just literally tell people, books under your feet, step stools, get the exercise long thing, put it under your feet. And this is actually very important for ergonomics. And so I'll work with people in offices to really shift the way they have their desk set up, because it puts them in fight or flight mode. So first things first, make sure your feet can hit the floor and your knees are higher than your hips. So we have to adjust your chair position to allow that to happen. If it means stacking several books up, then we need to do that. Wooden planks, whatever we need to. And then making sure your low back can touch all the way. Sometimes I'll have people where their knees are a lot higher than their hips just because they really need to get turned off for their nervous system. And then if, like the desk situation, if the desk is too high and they can't adjust it, then I say, okay, lift up your chair, but then put more books under your feet. If you're out and about, I would recommend a bigger purse that you can stick under your feet. Those are some things I truly tell people, just ways to find it. If you're sitting in a bar stool, put your feet on the rungs, make sure your heels are touching to calm you down, because it also activates your hamstrings to pull your pelvis into position to calm you down. Watch, and this is, sometimes I catch myself where I'm sitting and my knees, I'll get higher than my hips, but I'm up on my tippy toes. Now, obviously I don't want my calves working all the time like that, but for a short period of time, that'll at least keep my pelvis back in neutral. But ideally I'll shift so that way my feet can get flat, or I put something under my feet.
What about the teenagers that are completely slouched, or the patients? Like, I have people that are so compressed, they can't access air because of the other direction.
Yeah. So with them, so I'll still do stuff where I will work on them releasing their pecs. So if they're completely slouched the other way, I'll start looking at, okay, where is their rib cage? Is it really too far forward? Is their pelvis? What's going on in their pelvis? So if they're too far forward, then I'll have them go into positions, like I'll lay them down on their back, and I'll start to teach them different positions of moving their arms up. But as they're breathing, they're feeling their chest drop down and in, and their pecs release. So depending on how hunched they are, you may have to adjust and put pillows under them if they can't lie flat. But what ideally I'm working on is that they can get their rib cage into neutral, separate from their shoulders, so that as they're breathing, they're not going like this to breathe and just throwing their shoulders to breathe, but they're breathing. So the rib cage drops down and in neutral, but I'm not trying to get them to be a hunchback. And so if they're already this way, we have to slowly open them back up. But as they're doing that, still learning to free up their rib cage from their shoulders and neck, so that this still drops down and in and gets them out of kind of a barrel position, or kind of whatever position they're in. Often that's a barrel position. And so there's still work on the rib cage dropping down and in, but it's while they're learning to open up at the same time, so that they're not so dominant on their pecs or rectus abdominis and just curled up too much. So
Thank you.
yeah. Anything else? So, and I'm here for questions. If you guys can reach me anytime after that, I'll put my email. Oops, that's supposed to have 1 O in the com. If you have further questions, or you're ruminating over anything I said, or you want to connect or chat or work together or anything like that, feel free to reach out to me. I also have a wellness show I do on the weekends. If you guys are ever interested in chatting about that, I do host people in all walks of life. I call it the Weekend Wellness Show, but I'm actually thinking about changing the name to address the fact that I want to interview people who have gone beyond traditional healthcare and help people in unique ways. So reach out to me if you're interested in that as well, because I'd love to feature you guys. I've featured Veronica and Kathleen, so they're aware of it.
Yeah, so if you'd like, Amy, maybe you can, because I know they're recording this, so maybe we can share this on the Facebook page.
Sure.
And then with that, when you share it, put any of your resources of how to find you, your YouTube channel, your Facebook Tuesday, Thursday event, so that we can kind of chime in and start experiencing it more. If somebody that missed this, they have an avenue to chime in and sort of learn and feel and experience.
Yeah, definitely. I can totally do that. Awesome. Anything else? We're good. Do you have anything else, Veronica?
No, I was just going to say thank you so much, Amy, for presenting, and everybody for joining, and your questions and new faces that I got to meet and see. And if you're interested in presenting, please let me know. I would love to have you present, or if you're interested in being on Amy's Weekend Wellness Hour, it's a fun experience to be able to reach the general public and share more about what you do. So it's a great opportunity too.
Thank you very much.
Yeah, thank you guys a lot for listening, coming. I appreciate your interest. Very, I like to share this stuff because it is unique in the sense of what's happening and how I've helped people. So, and I know you guys all have amazing things going on as well. So it's fun to share that with different practitioners and to get to know people and say, oh, okay, this may resonate with one person, but maybe not, and you can send them somewhere else. So appreciate it.
And if we're sending you a patient, do you usually say, try 2 to 3 visits, or what formula do you like to use?
Yeah, people typically, I like to say at least try 3 visits, because the first visit, it's 90 minutes long and we're going through everything, and they start learning stuff the first visit. And then there's always people are like, wait, what's going on? And then they start to feel things. And then the next visit, we start progressing and adding more stuff. So how to use your legs differently, how to use your arms differently, how to change your rib cage to feel less stress. So there is a process. And if they have at least 3 visits, they feel how their body starts to transform. So.
I just want to say one more thing, because when you were telling your story about how you initially got into this, you said, I went to a PRI class and they taught me this, this, this. Do you feel the shift? And you said, no, I don't.
Yeah.
And I feel there's so much pressure in those situations to be like, yeah, I feel it, or I will at some point. So props to you for saying, no, I don't feel it. And I'm going to find a way to take this and move into what I want to do with it. Because without that, like, that's all we need. I love that.
Thank you. Yeah, it's scary to say no when you're in a class of 60 people. You're like, wait a second, I didn't really feel that. Or I feel a
Yeah.
difference. And it's not to say, I mean, I didn't feel a difference. I didn't see a change in my body. And so when I'm working with someone, I'm like, I need to know if you don't feel a difference, that's okay. That means you're not in the correct position that I need you in to get you to feel a shift in your rib cage or your collarbone or whatever it is. It means we just have to change it. And that's part of it. That's why it's such a moving target, is I can see what a person needs. Now, how do I get them to get that? And it's it's hard sometimes. And as you pull things out of thin air and you're like, okay, how do I get that? And you just start literally, there are things I've had people do. I mean, in cars and outside, like you get creative.
Totally.
So, yeah.
Perfect.
Amy, I like how even though you shifted, you stuck with a very active approach and empowering the client to to better themselves. So I think there's a common theme here, whether it's PRI or or whatever you go into. I think sounds like it's kind of fitting in line with how you like to treat.
Yeah. Definitely. Thank you, guys.
Great job.
Thank you.
Thank you, everyone. Hopefully we see you next month or the month after.
Thanks.